As we head into winter, our teams at University Hospitals Plymouth are working hard on reducing the waits at our emergency department. As well as ensuring that the flow throughout the hospital and discharge processes are efficient as possible, staff are working as hard as they can to get patients into the emergency department to be treated. Nobody wants to see patients waiting in ambulances, and we're working with all our system partners to ensure that we're doing all we can to reduce those waits and help secure onward care for those waiting to be discharged.
Hello, my name is Kath Potts. I'm Deputy Chief Operating Officer here at University Hospitals Plymouth. I wanted to talk to you today about some actions we're taking right now to deal with our sustained pressures that we are seeing and planning going into winter. Some of the actions we are taking are investment into our same-day emergency care service. This will mean that patients will be seen and treated on the same day and sent home, meaning that they will not have to stay in hospital for some of our common conditions such as low-risk chest pain, respiratory illnesses, some cardiac conditions and for some chronic diseases. We are investing in staffing across the organisation in both emergency care, across acute medicine and same-day emergency care, as well as across our hospital site to maximise flow and ensure patients are seen in a timely fashion. This includes investment to our wards and for our support services such as phlebotomy, and to our administration teams such as with our ward clerks and patient flow coordinators. In addition, we are preparing for winter with our new respiratory support unit to ensure that we are getting patients to the right place. Other initiatives include investment into our virtual ward offerings, which will mean that patients can be cared for at home and discharged earlier. We have a continued focus on our discharge programme and getting patients home safely from hospital. This includes the campaign of Home for Lunch, which you will hear about in a different video series, and the importance of why this is essential for winter, and our ask of both patients and families in ensuring that we get patients home for lunchtime. Our other very exciting initiative is our Hospital to Home scheme, which is a team of experts in therapies who you will also hear from in a different video series about the service they are providing. This includes therapy from occupational therapy and physiotherapy, and they're helping get our patients home earlier, providing care support services at home and making sure that patients are not sitting in hospital for any longer than necessary to prevent deconditioning. Along with the actions that we are taking here at University Hospitals Plymouth, we're working closely with our community and system partners across Plymouth, Devon and Cornwall to ensure that we have appropriate offerings across community services, primary care, mental health and our community hospital sites to make sure that we have provision to have services for patients to avoid coming to hospital, but also to ensure that patients are discharged in a timely manner. Our commitment here at University Hospitals Plymouth is to make sure that no patients wait, whether that's for an ambulance, for discharge or for any investigations or diagnostic tests. Our staff and families are patients too, and our plans for investment in staffing and services and for winter are working towards that goal of making sure that no patient waits.